Beginning of the 21st century was when I did my training as a pediatric resident. And back then, the what we call as the pediatric ICU was literally two beds. I believe in block 7 or block 8, where we accommodated children in the main ICU, which was mostly an adult ICU. And if we had any other children who required a bed, we would either shift them out, or if there was space, there would be spillover in the adult ICU. At that time, we believed that any baby who went to the ICU would most likely die. And that is a very serious issue that we had at that time, where there was a complete lack of awareness of the importance of pediatric critical care medicine. There was a lack of recognition of the importance of how children are so different from adults. It was also an issue of opportunity, of space, of having trained, leadership and skilled personnel to be able to practice pediatric critical care medicine. During this time, Dr. Anwarul Haq, and I think you will see him in one of the workshops. Most of you probably already know him. So he was the one who established the first pediatric ICU at the Aga Khan University. And I would say that was the inception of pediatric ICU. And I remember one of the first children that we saw at that time was a child with hemolytic uremic syndrome. And this little boy, about 4 years old, I believe, he stayed in the PICU for almost 3.5 months. Every organ in his body failed over the period of the 3 months. We saw all kind of infections. When he was shifted down to the ward, he had severe, I believe you call it as critical care weakness. So he was almost near paralysis, very depressed. He had had seizures. He had recovered. His kidneys had recovered, but he was there alive. And for me, that was, I believe it was the most miraculous moment for me to see that child go through all of those troubles, and to survive. And even in the ward, I saw him fight. And you will be so pleased to hear that that boy was my daughter's class fellow, and both of them did their O levels together. Now, this is the testament of the hard work and the skill that a good PICU environment with having good skillful people can make a difference to the lives. And I think that we have come a very, very, very long way from where we were in those years. A huge credit to all the not local, the everyday heroes of the pediatric ICU, all the forefronters, our nurses, our nursing technicians, nursing assistants, RNs, uh, the poor UR, and I think the URs have really changed as well, they've evolved in the PICU. Of course, much gratitude to all of our intensivists and all the ancillary and all the people who support the care of these children, which includes physiotherapy, which includes our specialized pharmacy now, because it's just a much more specialized field. The infection control teams, and I think it's just even the support of the the biomedical staff and everybody. I think it's just such an extremely multidisciplinary service now, and the way it has evolved is really, it's very, very heartening. And I feel very privileged that I'm standing here as a chair of the department that owns this pediatric critical care medicine program, not just with its training, through which we have provided critical care consultants across Karachi, across Pakistan now, and also absorbed so many of our own alumni into this program who are paying it forward, continuing to train others. I must congratulate all the people who organized this program, and I want to say that I hope I can attend most of the sessions that you plan for this week. Thank you so much.